That's right, we are Smooth 98.1. Love music, love life. If you just joined us, you are just in time. It's time for the Smooth Health Show. And of course, we have a very special guest in the studio. We've been joking about his role at Evercare. And you know what? Judith is just going to give you the details of who he is in a second.
Yes,
but
indeed.
Before we give you the details, don't forget, like we mentioned, we're giving out vouchers courtesy Evercare Hospital. And we'd love for you to be a part of our conversation. So reach out to us either on WhatsApp or just call the studio lines 014489981 or just send us a WhatsApp message. Send it to 0809-444-0981.
Yes, indeed. We have our doctor here today. His name is Dr. Promise Ebuka Okonkwo. Is a trained clinical audiologist and speech language pathologist at Evercare Hospital, Lekki. He's experienced in advanced diagnostics, hearing and balance disorders, and hearing amplification technologies. Dr. Promise is a licensed professional with the Medical Rehabilitation Board Therapist of Nigeria, MRTB, and a speech pathologist and audiologist association member of Nigeria. And today's topic, we're talking about, of course, from the bio, you already know, it's hearing loss and a silent killer. Hearing loss, a silent killer. Doctor, you're welcome to the show.
Thank you.
I would need you to speak into the microphone a bit. There you go.
There we go. Can you say that again?
Okay, thank you very much. I'm happy to be here.
It's wonderful to have you.
Ebuka Okonkwo. That's it.
Okonkwo worked very hard.
Yeah.
To plant a new farm.
What did you say?
Okonkwo from Things Fall Apart.
Exactly.
Everybody
Quickest way to
can
remember.
get familiar with that.
Yeah. And also Ebuka from, you know who.
From BB Niger.
From Nigeria.
Yeah, BB Niger. Do you watch it? Do you watch the show?
Once in a while.
I feel like this season does not have what it. I feel like the other seasons.
It's doing it again. All right, but doctor, you're welcome to the show.
Thank you very much.
All right, so I mean, from your bio, I keep hearing audiologist, and I thought, I mean, me, I work in audio. I should be an audiologist, but who is an audiologist, and what are your focus areas in your specialty?
Thank you for that question. Well, as an audiologist, basically, audiology basically is a field of hearing. It's a branch of science that deals with hearing and balancing disorders.
Okay.
So basically, audiologists are professionals that are trained to take care of individuals with hearing concerns and balancing issues. You identify them, then you prefer solutions.
Awesome. Identify, then prefer solutions. Because we're going to talk about
you
a few
can identify, assess them, then
prefer solutions. Yeah. Okay, so according to the World Health Organization, they say that hearing loss is the 4th highest cause of disability globally, which is shocking, by the way. And it further says that they further say that with more than 450 million people with this condition. So the question I want to ask you is, what is hearing loss, and generally, what are the causes of it?
Okay, simply put, hearing loss is inability to hear well.
Okay.
Like normal people.
Okay.
When I say normal, we have the way we classify it.
Okay.
We have the normal threshold, we have the mild, we have severe, we have then up to like profound. So basically, if you cannot hear normal when you are being assessed, we carry out an assessment, and if you're not within that range, if you're not within that threshold, then we say you have hearing loss. You might still be able to hear well and communicate with people, but for us, we believe you have a loss in hearing.
And people that are susceptible to this, people that work in the media, like wearing headphones all the time.
Well, yeah.
DJs, I'm just saying, because we wear headphones, I mean, six out of 7 times a week.
Yeah, well, it depends. If you always turn up your, the sound, the volume, then
so I'm telling you,
I would say it will affect you. But if it's not something you always turn up, then I think you're fine.
Okay.
You asked about my area of specialization.
Yes.
Diagnostic audiology, rehabilitation audiology, and that's basically what I do.
Okay, so diagnostics involve what exactly?
Yeah, that's just the process of evaluation and assessment. You diagnose.
Okay.
Before you can diagnose, you have to assess, you have to evaluate. Then you come out with whatever it is that is wrong with the patient. Then the rehabilitation aspect of it basically is you rehabilitate, from the word rehabilitation. You diagnose, you get a result, then what is the next thing to do to this person? You rehabilitate. For someone who has hearing loss, you can prefer let's say hearing aid or cochlear implants.
Okay.
So with cochlear implants comes rehabilitation.
All right.
And hearing aid too.
So what are the risk factors of hearing loss?
Okay, exposure to loud noise, it's a risk factor. And basically it's one of the major
Exposure to loud noise.
Yes. Exposure, if you work in an environment where you are exposed to a lot of noise, maybe construction site, you work as a DJ, you always like to go to Owambe.
The music is really loud.
The music is loud. That's the infection, diseases, consuming medications that are not prescribed, orthotoxic medication.
Wait, consuming medication that's not prescribed. How does that affect the ear then?
Yeah, there are some medication that are actually not good for the ear cells. There is a cell in the ear that is responsible for sound transmission.
Okay.
So when you continue to consume this medication, let's say antibiotics, there's a level you take them to, they will definitely affect your hearing.
Oh, wow. If you're out there and you got questions for our doctor today, well, feel free to send us those questions. You can send them to our WhatsApp platform, which is 0809-444-0981. Better yet, you should call us. Call
Yes,
the
indeed.
number
On 0144-89981. Again, 0144-89981. By the way, we're streaming live on YouTube, so go on there to our YouTube platform and catch us live on there. It's at Smooth 981 FM. Again, at Smooth 981 FM. Make sure to click the notification button and subscribe to our channel as well, and catch us live on there so that you can be notified each time we go live. All right?
That's right.
Let's do that.
Okay, so let's talk about age, right? So, big question here is this: does age play any role in hearing loss? And also, what stage does it lead to deafness? Because I have a number of questions around this particular question in a way. We see young people today. Everyone's wearing AirPods, walking on the road, and then we also see older people that need hearing aids. Amongst other things, they're not wearing AirPods. They're not, exposed to the type of loud music or loudness in general. So, at what generally, like you mentioned, the risk factors. Now, what age does hearing loss really apply when it comes to all of this?
Yeah, I would say 40.
Okay.
But naturally, when we age, just like every other part of our body, we tend to lose our hearing.
Okay.
Where you age, you lose your strength at some point, you become weak, you lose sight at some point, not like total lose, you know that the way you can see. So basically what I tell people is that our ears are organs.
Okay.
You've used them for like 40 years.
Oh, wow. You make it sound like it's a bad thing.
No, it's not a bad thing. It's a good thing. You understand? But at some point, they cannot be as effective as compared to, let's say, a teenager.
Okay.
Because you're exposed to lots of loud sounds. You've done a lot of things. So you've been using it. So at 40, it's always good that you begin to assess and evaluate your hearing. Then for young generations, for young people that are using AirPods and earphones, yeah, it's really, really affected the ears. Just like I said the other time, when you tune up the sounds, let's say 85 decibels and above, that's loudness.
Mm-hmm.
This will definitely affect your hearing because it goes straight into the organ that is responsible for sound transmission.
Okay.
And the organ, just like the air on our head, they eat off gradually. And once they begin to eat off gradually, then hearing loss comes in.
Oh, wow. Okay.
Wow. You can join the conversation, as we said earlier. Call us up on 0144-89981. So, doctor, how can hearing loss be prevented, and what roles do earphones and earpods play in this situation?
Okay. The best way to prevent hearing loss is, I think we should even look at the basic things, the common thing that a lot of people do. We poke our ears with cotton balls.
Cotton balls are good. You didn't say barrel covers. That's crazy.
Brooms, feathers, broomstick, a whole lot of things.
Sorry, doctor, before you go forward, let's just quickly take this call.
Okay.
Hello. Good evening.
Hello, good evening.
Good evening, Sociable. How are you doing?
I'm good.
All right, go ahead, Sociable. You have a question for our doctor.
Doctor, please, I'm very happy listening to this wonderful topic. I want to find out this constant usage of phones. Because for me, I've always believed that using earphone is not too healthy and it may cause these hearing issues. So now I've jettisoned that. Now, placing our phones directly on our ears and you receive like 10 to 50 calls in a day. Does it have any effects to one's hearing and all that? And what is the solution to prevent it? Do we start using speakerphones, or what can we use to prevent it from getting into our system?
All right, thank you so much for calling there. Appreciate your call, Sociable. Call us up on 014489981. Again, 014489981. Doctor.
Okay, phones are good gadgets, actually. It helps us to communicate. But what I would advise is that when you're using your phones, you should monitor how long you use them. Okay. Like he said that, like, you receive calls like 50 times, I don't know, unless you're working in a call center, it shouldn't be that much. But when it comes to a point where you receive a lot of calls, you should give your ears a break. If you're not giving it a break, definitely and naturally, you are putting a lot of pressure on that ear. And as time goes on, you definitely will lose your hearing. You understand? You might not notice immediately, but gradually, maybe in the space of 10 years. But I feel once in a while, calls receiving shouldn't make you go, shouldn't make you lose your hearing.
What about cases of, occupational hazard? For those that are like call center, workers that have to put headphones and telemarketers that have to call people and, tell them about their goods and services in that type of situation.
Yeah, the simple thing to do is listen low. You don't have to increase the volume so loud. When the volume gets to a particular, let's say 85 decibel. I'm using 85 decibel because 85 decibel is quite loud.
Okay.
And you use it for a long stretch of time, it's definitely going to affect your hearing. It might not be immediately, but as time goes on, you can work in a place for 4 years. So for somebody like that, in that space of 4 years, and you keep going by the same decibel, the same threshold, then it's going to affect your hearing.
So I know some people that buy some headphones, they have noise cancellation because of some of the kind of work that we do. So you're saying now, in essence, that, don't get those kind of headphones, and also don't listen to whatever it is that you're producing or listening to really loud. That's essentially what you're saying.
Essentially, you don't necessarily. One thing our ears does for us is that, let me give you a practical example. If a generator set is turned on here now,
yes,
it should be very loud. At some point, you're like, this is too loud. But at some point, you get so comfortable with it without knowing naturally. The same thing happens until the generator turns off. You now go, wow, I've been exposing my ear to this all along. The same thing happens to us when you listen so low. At first, you might feel like you're not hearing well, but your ears will adjust, your brain will adjust, then you begin to hear well.
All right.
We need to take a break here.
We do need
to take a break at this point. When we come back on the other side, we'll take more of your questions and, of course, your comments as well to join the conversation. Remember that you can send all your questions to Doctor. We have Dr. Promise Ebuka Okonkwo. He's an audiologist with Evercare Hospital. We're talking about hearing loss, a silent killer. All right. So if you have any questions at all for our doctor, please join the conversation. Send us questions to 0809-444-0981. You can also call us up here in the studio, and you stand a chance to win 10,000 naira worth of voucher. It's courtesy Evercare Hospital, and that voucher goes to your first consultancy at Evercare Hospital. So call the number 014489981.